When you're out and about this summer, you might find yourself swatting away a few extra mosquitoes. Good evening, everyone. I'm Ryan Kennedy.
I'm Kristen Rebbington. Thanks for keeping it here with us at 5:30, and here is why. Right. Northern Nevada Public Health says it's considering cuts to its mosquito treatment services. Alan Bean joins us live in the newsroom after learning more. All right, Alan, what cuts are we looking at specifically?
Yeah, Kristen, Northern Nevada Public Health says it is suspending large area treatment for the 2026 season, which runs from May to September. The agency says it's navigating multiple funding challenges. In 2025, Northern Nevada Public Health grounded its mosquito-fighting helicopter to cut costs. Now the agency is evaluating these services again.
It's always a challenge to fund public health in many points.
District Health Officer Dr. Chad Kingsley says the agency's funding mostly comes from grants and a tax transfer from Reno, Sparks, and Washoe County. He says all three jurisdictions are facing budget cuts, plus some annual grants have been cut in half. He says mosquito services are on the chopping block since there's bigger concerns in Washoe County.
It is definitely a nuisance. As a disease-carrying agent, it's significantly less the other things within our community.
Since 2020, NNPH says it's seen one case of a vector-borne illness in Washoe County, a case of West Nile virus in 2022. While we don't know which treatments will be put on hold this year, we know what cuts looked like in the past. Just last year, NNPH saved about a third of its budget by keeping its helicopter on the ground and skipping out on larvicide.
That ranged to over $200,000. So we did not fly it this year. We collected data on it, continued our educational services, as well as trapping of mosquitoes.
Given the hangups with grants and tax transfers, Northern Nevada Public Health will look into different ways to fund the fight against mosquitoes. Kingsley says one option is to look into other grants, but choices are limited.
There is also the option of perhaps there's a ballot measure, or working with our state partners to see if there's any legislative point that we could do. And then there's always seeking out community if there's private funding or anything that could be able to help provide for this.
Dr. Kingsley says the county's District Board of Health will meet in the future to figure out which services they can afford and which ones they'll have to put on hold this year. Covering the story, Alan Bean, 2 News Nevada.